Hello, my name is Zulfan Farhi. I am the founder of JIWA, which is also known as the Joint Initiative for the Well-Being of All. So JIWA is basically our initiative ever since the COVID-19 pandemic. In my personal life, there were some events that changed my trajectory. It was when I heard about a friend of ours abroad. She had taken her own life. When we heard that, it was definitely a huge shock to us because this person was also known to be the cheerful one. So when we heard that, it got us questioning what was really going on inside a person. Fast forward into my degree, I studied a lot about antidepressants. Going back to Brunei, I gave my first ever talk to a youth school, and I found the same kinds of patterns in these youths. I couldn't help but just remind myself of what I could have done or what I could have said to this friend of mine. That was when probably JIWA really started, because I realized that this needs to be said. I realized that in Brunei, most people don't know where to search mental health resources. So there needs to be a centralized, trusted, and credible information specifically for Bruneians in my experience at that time. So we work with mental health professionals in Brunei, psychiatrists, psychologists. So we wanted to really make a credible information for students. And then from that, we finally introduced the Student Wellness ebook that we are trying to give away to schools. When we introduced the support groups back in 2022, at that time, I, as a man, didn't have any support. So instead of trying to find one, I created one. I created a space where men can get together and then find support. After that, that's when it started to become more universal for both men and women, and also of all ages. We cater to a very diverse population, but the majority of the people that join the support groups, they're mostly of the youth ranges. So how we engage with the community is, as you said, we really engage with them physically, because what we've sensed that was losing, especially during the COVID-19 pandemic, as mental health issues in Brunei were rising, the social connections became less. So we wanted to really reignite this passion for the community. When a community starts to really break down, you will start to find a lot of people become more isolated, and therefore a lot more mental health issues. So what I like about, especially with what we're doing with support groups in JIWA, is that there is no one way to heal. For us, especially the kinds of people that we meet in the support groups, they're not necessarily always the most vocal. Some people prefer to paint, some people prefer to write, some people even actually prefer to talk. What was interesting is that how we approach healing is that it doesn't always have to be with a professional. What we found with our project JIWA Senja is that 85% in our surveys, they didn't need mental health professional help. So from that, we are relieving the pressure off the healthcare system. We're finally increasing the access to those that actually need it. We inspire, we educate, that's why we collaborate with professionals, but at the same time, that's not the limit. We also like to be creative in the ways that we express ourselves. For JIWA, it's not just a one step for healing. There's many ways. Silent struggles is definitely not an easy thing to deal with. It is not something that anyone can just freely express, and we understand that, which is why getting into a peer support system is still the most important part. It doesn't have to be conversations about trauma. What we find in the support groups that we've done is that people simply just talk about themselves, and it doesn't even have to be about their problems. It can be about something that they're passionate about. There is that sense of belonging, again, that is necessary for every healing. So if you are still silently struggling, I'm sorry. It is definitely not something easy to deal with, and I know that it's a very heavy thing to carry. But there are always ways, and we always accept anyone from any parts of life. JIWA is a good place to start. You can come to our support groups where it's a very safe, very cozy, and non-clinical type of pressure. I encourage you to just join our free support groups every month, and then just to see for yourself if it works for you.